Hi, I'm Dr. Joy Steadman, and if you're watching this, then you want to know something about the anesthetic for your upcoming total joint surgery, your total knee or your total hip. Now, a lot of times when people come to the hospital, they just assume that they're going to have general anesthesia, what we commonly refer to as going to sleep. It's literally more like a chemically induced coma. But for things like total joints, over 140 studies have shown since the 1980s that having spinal anesthesia reduces the odds that you have a heart attack, a blood clot, decreases the odds of getting an infection, and decreases the odds of having chronic pain afterwards. So what I want to talk to you about is the first thing that we're going to do for you when we take you back into the operating room for your total joint surgery. When we're doing a total knee or a total hip, typically what we do is spinal anesthesia, sort of like what we do for C-sections, except you get sedation. Now, if you think of this as being your spinal cord floats in a sac of fluid, and that sac of fluid goes down several inches below where the spinal cord ends. And this is where we do spinal and epidural anesthesia, so people don't have to worry about us sticking a needle in their spinal cord. The little bones of your back, the ones that are called spinous processes, those are little tiny bones. Spine surgeons sometimes remove those when they're doing spine surgery, but we don't get to remove them. We have to go between them. So how the patient sits is crucial. And what we need is for you to slouch, because when people slouch, that opens these little bones up so that we can slide a needle in between. That needle is smaller than I start IVs in newborn babies. It's long, but it's very, very thin. We slide it in between those bones, put the medicine in that fluid-filled sac, and then the needle goes away. So the needle's only there for a few seconds. Then that medicine floats up, and it makes you numb so that you won't feel the pain of the knee surgery. The great big bones, when people fall down and break their back, or they have a ruptured disc, those bones are deep inside. And we're not going to bother those bones. So we're not going to give you a ruptured disc. We're not going to give you a broken back. Now, spinal anesthesia has actually been around since the 1800s. The medicines that we put in the spinal have been made better over time. And we put two medicines in. One is a numbing medicine. The other one is a pain medicine that's kind of like morphine. It's called fentanyl. And with those two medicines, we can give you a good solid 2.5 hours of spinal anesthesia while the surgeon replaces your knee or replaces your hip. Now, after your knee surgery is over and you're in the recovery room, we're also going to do a peripheral nerve block. And with the peripheral nerve block, we take care of the pain in the front of the knee by putting medicine up by the femoral nerve. And if you think of the femoral nerve as being where the leg meets the body, in that crease, the femoral nerve is right there. And we're going to use an ultrasound and a nerve stimulator to put the medicine exactly where we need it. And that medicine lasts anywhere from 12 to 36 hours. So after your knee surgery, you're going to have an additional procedure. After your hip surgery, you're just going to go to the recovery room, the spinal is going to wear off, and you will get pain medicine. I hope this explains the beginnings of what you want to know about your total joint surgery, and I hope the day you come in for your surgery, you still have some questions, and we're happy to answer them. Thanks.